Helping patients to get the right care sooner is what Trinity Health is all about. And from coronary CTA for diagnosing blockages to calcium scoring for assessing heart attack risks, there are non-invasive imaging tests giving doctors clear insights into your heart health. And today we're joined by Trinity Health cardiologist, Dr. Omer, to talk about how advanced cardiac CT scans are improving heart disease detection and prevention. Thanks for being here, doctor.
Thanks for having me.
Absolutely. We should probably start with the disease itself, a coronary artery disease. Could you describe what's happening there?
Yeah. So coronary artery disease is essentially a buildup of plaque within the actual lumen of the blood vessel. And this buildup of plaque can progress over the course of time depending on lifestyle, depending on genetics, and essentially can ultimately lead to a blockage which could present as a heart attack or symptoms.
So obviously something that we want to avoid, a blockage in an artery. You mentioned a lumen. What exactly is that?
So the lumen, essentially, if you think about a coronary artery like a garden hose,
okay.
Within the garden hose, you can have deposits of minerals, and that is synonymous to a blockage or deposits within the blood vessel.
Okay, so just envisioning that too, getting smaller and smaller and the blood not being able to flow through.
Absolutely.
In the past, when it comes to diagnosing this, it was a bit more invasive than it is these days.
100%. So technology has substantially evolved over the last 30 years. We have a lot of advancements and progression when it comes to imaging, and classically to identify whether or not there was a blockage, you'd have to physically go up and visualize the heart invasively, and there's of course risk involved, but now we have the ability to visualize these blood vessels, blockages and buildup without needing to physically, poke or cut.
Yeah, so I love that. So the non-invasive means exactly that.
100%.
You're not entering the body, you're taking images of the body. These CT scans have become more and more common. Who is getting these? Who's eligible for a CT scan?
So classically it was limited to a sub-select group of people, but now it is more widely available for many individuals. So if you think about it in terms of prevention, folks with any cardiovascular risk, diabetes, high blood pressure, any family history of heart disease, any family members, first degree particularly, that had heart attacks at a young age, even if you're healthy, and you want to stratify your risk, you want to know whether you're low, intermediate, or high risk, a calcium score would be a good diagnostic test for that. Now, for a coronary angiogram, if you want to know whether or not you truly have blockages, of course there would have to be some form of symptom involvement for that. So they're both CAT scans, but one is primarily for diagnostic purposes, identifying a problem, and the other one is purely for preventative evaluations to kind of put you in a category, whether it be low, intermediate, or high risk.
So whether you have symptoms or not, you can get this scan done.
100%.
And know that preventative. And you are you're part of a network, a cardiovascular network. That's across
correct.
West Michigan. Can you talk about that?
Yeah, absolutely. So our cardiovascular network, it's in collaboration with the University of Michigan, locally here, University of Michigan Health West, a group of phenomenal folks, doctors, cardiologists, really well trained, and folks that do deliver various aspects of heart care, from prevention all the way up to the most advanced structural and coronary and peripheral vascular procedures. So
that's got to be very convenient to know that you can get pretty much anything with the heart covered within this network.
Absolutely. So we are able to provide the full gamut of cardiovascular services here locally. We have excellent physicians, cardiologists that are really highly and well trained. I know them all. They're a great group of people, and very personable and very easily accessible and easy to talk to. Great people.
Okay, one last question for you. So people, if they're presenting a symptom, what symptoms would someone be presenting to think maybe I should get one of these scans?
Yeah, so when it comes to the coronary artery calcium score, you don't necessarily have to have any symptoms.
Sure.
However, like I said, generally speaking, if you have a family history of heart disease, if you are a healthy, professional, young individual who happen to have, a strong family history, father or an older brother with a heart attack at a young age, and you want to, what I tell people is generally what resonates with people is if I can empower myself or if I can empower my patient to understand their heart health better, the coronary calcium score would be the test of choice. So the best example would be, a 50-year-old male without really any risk factors, but happens to have a couple of family members with early onset heart disease. That would be the ideal person for this test. Or if someone has high cholesterol but otherwise healthy, no other problems really active, this would also be the test for him to essentially tell him whether or not he needs further treatment. Or the way you want to look at it is it's a good investment for your future health, future cardiac health specifically. That's the calcium score. Now, when it comes to the coronary CTA, or coronary angiogram is what we like to call it, CT angiogram, if you have a test or chest pain symptoms or shortness of breath symptoms that are ambiguous or not really pointing towards the heart, but could be the heart, right? But you don't want to go and do further testing. You probably already had a stress test. It may have been normal or it may have been inconclusive. This would be the test to identify whether or not anatomically you do truly, or whether or not you truly have a blockage.
And of course, Trinity Health has this rating for you, readily available. What great information you would have, because you don't know what you don't know, right?
Absolutely.
So get this information. TrinityHealthMichigan.org/cardio. If any of what you just heard the doctor say hits home for you, you might want to check that website out today. One more time, TrinityHealthMichigan.org/cardio. We'll be right back.